Hey everybody, and welcome to this CyberMD lecture on Paroxysmal Supraventricular Tachycardia, or PSVT. Sometimes this is referred to as SVT. PSVT is a type of supraventricular tachycardia, a rapidly beating heart rhythm that originates from above the ventricles. It is an important topic to cover as a part of your preparation for the USMLE STEP 1 exam, and it is a common arrhythmia that you will encounter in clinical practice. Please be sure to like, comment, and subscribe so that we can continue to provide free medical education resources to students around the world. PSVT is caused by reentry circuits within the atria or the atrioventricular node. Reentry is a phenomenon where an electrical signal circles back on itself and creates a continuous loop, leading to a rapid heartbeat. Other causes of PSVT include underlying structural heart disease, electrolyte imbalances, certain medications, and metabolic disorders. PSVT is relatively common, affecting people of all ages. It is estimated to occur in 1 to 2% of the general population. With that being said, it is more common in females and is the most common arrhythmia in infants and children. Again, listen to that last part. It is the most common arrhythmia in infants and children. PSVT occurs when there is a rapid and irregular heartbeat due to the reentry circuit. This can lead to an abrupt increase in heart rate, often leading to symptoms such as palpitations, chest pain, diaphoresis, shortness of breath, and lightheadedness. These symptoms may occur suddenly and resolve spontaneously or with certain maneuvers, such as coughing or changing body position. Physical examination of patients with PSVT may reveal a rapid and irregular pulse and the presence of heart failure symptoms if heart failure is present. The evaluation of PSVT involves obtaining a comprehensive medical history, performing a physical exam, and obtaining an EKG. The EKG is crucial in confirming the diagnosis as it can demonstrate the rapid heart rate seen in PSVT. Other tests, such as an echocardiogram or a stress test, may be performed to evaluate for underlying heart disease later on in the treatment course. On EKG, PSVT is characterized by a rapid heart rate that ranges anywhere from 160 to 250 beats per minute, sometimes with regularity and sometimes with irregularity in the rhythm. The EKG may also demonstrate the presence of an accessory pathway, or the absence of normal electrical conduction through the AV node. The treatment of PSVT is focused on controlling the heart rate and preventing the recurrence of episodes. This may involve the use of medications such as beta blockers, calcium channel blockers, or adenosine, and it may also include invasive procedures such as radiofrequency catheter ablation. In really severe cases, cardioversion may be necessary to restore normal heart rate and rhythm, especially if the patient is hemodynamically unstable. However, before advancing to these maneuvers, physicians will often ask patients to cough, bear down as if they are trying to stool, or place an ice pack on their face. These maneuvers all stimulate the vagus nerve and may be called vagal maneuvers. Since vagal stimulation is stimulation of the parasympathetic nervous system, these maneuvers are aimed at slowing down the heart rate and restoring a normal sinus rhythm without any of the other interventions. PSVT must be differentiated from other arrhythmias such as atrial fibrillation, atrial flutter, and ventricular tachycardia. These arrhythmias include AFib, atrial flutter, and ventricular tachycardia, as well as other arrhythmias. They can have similar symptoms, and a thorough evaluation is needed to reach a correct diagnosis. The prognosis for PSVT is generally good, especially in patients without underlying heart disease. However, patients with underlying heart disease and uncontrolled PSVT are at an increased risk of serious complications, such as stroke and heart failure. The potential complications of PSVT again include stroke and heart failure, as well as tachycardia-induced cardiomyopathy and worsening of underlying heart disease if present. In some cases, untreated PSVT can also lead to sudden cardiac arrest. In conclusion, PSVT is a type of supraventricular tachycardia that originates from above the ventricles. It is important to properly diagnose and manage PSVT in order to prevent serious complications and improve patient outcomes. As future healthcare providers, it is essential to have a thorough understanding of PSVT, including its etiology, epidemiology, pathophysiology, presentation, evaluation, treatment options, and potential complications. By incorporating this knowledge into your practice, you will be well equipped to provide quality care for patients with PSVT. I hope that this lecture has provided you with a comprehensive overview of the condition and has enhanced your understanding of this very important topic. Thanks for tuning in.